can help.
Yeah, Dr. Chad Michael Daniel, is here to tell us how you can get an appointment faster. Good morning, Doc. How are you?
Good. How are you guys doing?
It's good to see you.
You as well.
So I was talking about the stories that I do. A lot of people come up to me and they'll go, I live in pain. You don't have to live in pain.
Absolutely not. You know, arthritis pain is absolutely treatable. We got a lot of non-operative options for patients who aren't necessarily looking for surgery. We can do injections, physical therapy, medications, things like that. And ultimately, if nothing else is helping, we can discuss surgery. But ultimately, my goal is to find the right treatment for each patient.
Exactly. There's no cookie cutter patient here.
Correct. Absolutely.
Is there a common age where this arthritis tends to pop up?
So it usually happens to our older patient population, right? Like osteoarthritis is the main arthritis that I deal with. We see multiple kinds, but that's the most common. And
osteoarthritis. And that's
wear and tear.
Wear and tear.
So we typically see it patients, 50s, 60s, 70s, or even older than that. But there are a few unfortunate patients that it sets in earlier in life, and they a lot of times have the same options. We try to put off surgery for our younger patients as long as possible. But at the end of the day, like if they're in pain, our age cutoffs are getting lower and lower because those people shouldn't have to live in pain either.
100%. And what is it? Is the missing of cartilage? It's bone on, so the cartilage dissipates or disintegrates?
Yeah. So what arthritis is ultimately is when the joint surface wears out. Where your bones meet, either at your hip or your knee, or really any joint, they have a coating of cartilage. It's like the slippery surface that lets them glide past each other. And when that starts to wear out, the surfaces get rough. And when that surface gets rough, it creates a lot of inflammation, pain, swelling, things like that.
And what, if people are continuing with this kind of pain, like what direction are they headed in versus if they come to you guys and get some relief? Right,
so usually we can't do anything to modify the course of the arthritis. It's going to do what it's going to do, and it's really unpredictable. Some patients progress really quickly and we end up doing surgery sooner than others. I have other patients that it takes decades for it to really get to the point where we get to that point. So it's really just monitoring each individual patient and making sure that we can keep them as active as possible, because at the end of the day, like if you're inactive and you're sitting on your couch all day long avoiding doing the things you enjoy doing, not only is life less enjoyable, but you start to get other medical problems, right? You start putting on weight, you start, getting pneumonias and cardiovascular disease. So we try to keep people active and healthy and enjoying their life as long as possible.
You might, I don't know if there's an answer to this, but I'm going to ask it. Is there a way to prevent arthritis?
So you want to be careful, right? Injury is the biggest thing, right? It's usually a bunch of micro injuries that add up over your lifetime. Some patients have really bad fractures that can really progress your arthritis and get the ball rolling. Avoiding high impact activities is generally what we recommend, but usually, everyday things like running and sports and things like that are okay. Like actually there's some research that shows that things like that can protect your joints, to a certain level. You start getting into extreme activities, like you're putting yourself at a little bit of risk.
What about rehab? When is that an option, tied to osteoarthritis?
Yeah, so we try to do some physical therapy beforehand, right? If your muscles are stronger around your knee, you can take some pressure off your knee. You want to make sure that you have good controlled joint motion to make sure that you have good mechanics. And then after surgery, obviously, the rehab portion of it's critical in order for the joint to function properly.
What are certain more body-prone body parts, more prone in areas of the body than others?
Yeah, so it's your weight-bearing joints that are really the ones. Like, so your lower extremity, like people definitely get shoulder, elbow, wrist, hand arthritis. But the ones that I see are the hip and the knee, and that's because you're walking on it every day, right? It sees that pressure every day, moving around, running, jumping activities really put a high load on it.
Isn't that incredible? All right, and the recovery time if you have to go through an operation?
It depends upon your definition of recovery, right?
Okay.
So like I generally tell my patients that the main recovery is the first 2 to 3 months. People the first couple weeks are a little uncomfortable. It progressively gets better after that. They see rapid improvement for those first 3 months. It really takes a full year for a hip or a knee replacement to fully mature.
And I had asked you this question off camera, but does the winter tend to bring out the pain a little bit more?
Definitely, yeah. People can definitely notice when the weather changes. I don't know the exact science of like the bariatric pressure causing more joints, but definitely the cold can make things stiff and achy.
So when Grandma and Grandpa are complaining about the cold and wanting to go to Florida, it's valid.
Listen up.
Okay, just checking.
Well, Chad Michael Daniel, we can't thank you enough for being on the show.
You're welcome. Thanks
It's a pleasure to have you.
All right, thank you very much.
On this week's Lost and Found, are you ready to bring home your forever friend? We're going to introduce you to a few animals who desperately need a family.
That's coming up next, right?